Hello, it's Friday, August 21st, and welcome to another legislative briefing with the North Carolina Medical Society. My name is Chip Baggett. I'm Director of Legislative Relations, and I'm here to talk to you today about Medicaid reform. It's been a historic week, not always really the best one that we've heard of, but it's still a historic week. We found out this week that the House caucus, through WRAL's post on Wednesday or Thursday of this week, has decided that they are going to support a dual role in Medicaid for new entities coming in. So not only the provider-led entities that we've been pushing, but managed care will also be a part of what they will be supporting, which is very much in line with what the Senate has been supporting. This is a big change, and it's a historic moment. And when we come to historic moments like this, I always want to take a second and just go back and remember where we've come from. So in 2010, the electorate changed and the Republicans took over. And we came in, and in 2011 and 2012, we spent a lot of time analyzing Medicaid and realizing just all the problems that have been popping up over the years that had been ignored. Things that were off the books, things that were not being accounted for properly, and all that ended up being multi-millions, hundreds of millions of dollars that you've heard about many times, time and time again, that led to the foundation of saying that Medicaid was broken. Medicaid's broken because all these things were out there that they didn't know were on the budget, that they had to put into the budgets in 11, 12, and then into 13. And that came from a lot of different directions. That wasn't any one particular place, but it still led to the conversation about Medicaid being broken. You'll remember back then in 2013 with the new governor and rolling out immediately this idea that we're going to go to managed care, straight up. Three-ish plans across the state. And how you turned that tide back. You had conversations with the secretary, with the governor, with your legislators, and said, we're just not really willing to handle that. But that led to a longer conversation, study committees, both at the legislature and one led by the governor's office, to decide that really a direction that we want to go in is something that is more provider-led driven, more run by doctors and other providers in North Carolina, something that's unique to North Carolina. That retained momentum, but at the same time, the legislature really decided two very important things. First, they decided that predictability was the absolute best answer. They needed to find something so that some answer to their budget problem so that they could say, this is how many people we have, this is how much it's going to cost, and that's it going down the road. The second thing that really happened is that the legislature decided that they were done with taking the risk. They were finished with being the partner with you, the providers, the physicians across the state, in bearing the insurance risk of Medicaid. And so while our provider-led entities were a solution for that, because they're fairly new and because they're doing something that is a step further than what we've been able to prove as successful in North Carolina through accountable care organizations in Medicare, where we've stayed a partner with the federal government and the state to a lesser degree in solving problems and managing care and saving money over time, they wanted somebody that was willing to take the risk on also. And that really limits physicians' ability to be a partner because you don't have capital built up in your practices. So we worked very closely with our hospital partners who were able to take on risk, and we created these PLE opportunities. But that just wasn't enough for the legislature to say, yes, we can rely on that completely. They've always wanted a backup plan with managed care or a backup trigger if we didn't cover the entire state or something along the way. And this week, I think just it all came together and they said, look, we've got to have both. The best thing is really to have both options out there. So we're now turning our attention from keeping managed care out, because I think that is a foregone conclusion at this point, and turning to what are the protections that we need in place, those things that I've been talking to you about now for a couple of weeks already, about patient and provider protections that are afforded to everyone that's buying commercial insurance. Shouldn't we have those same protections for Medicaid patients and for people seeing Medicaid patients? Shouldn't we continue to have clear goals outlined in the statute, not just for whatever the new entity is going to be, not just for the managed care companies to decide on their own, but directed from the legislature? If they're going to get out of the risk-bearing deal that we've had with them for years, shouldn't they at least decide what are the measures of success so that we can know whether the PLEs that we start are successful, whether the managed care companies that other people start are successful so that we can gauge that success going forward and decide whether this is really the plan that we need to be moving forward on. We still need clear and transparent data. That's something that we've learned from Medicare, our experience in Medicare. We've got to know what our goals are up front, and we've got to know what we're being measured on so that we can track that information and know that you can validate or disconfirm what's being told to you as far as how you're performing there. And it's also so that you can take care of your patients better as a fundamental piece. Additionally, we've got to know just the general idea of who is going to be relied upon. Are we going to still rely on a patient-centered medical home, something that we've said is the foundation of kind of where things have been established and the successes that we've had in the past? What are we going to do during the transition? Are we going to continue with the programs that we have, or are we going to risk exacerbating costs between now and whatever time we go to this next phase of Medicaid? So there are still a lot of questions, even though this has been a historic week and this big question that we've been arguing about for 4 years may have been kind of decided. There's still a lot more to decide between now and whatever time we leave. So now is not the time to disengage. Now is not the time to just throw up your hands and say, okay, well, they've listened to us in part by saying, yeah, we'll do provider-led entities, but we still want managed care at the same time. Now's not the time to give up. Now, more than ever, we need you talking to your legislators. We need you telling them what you think, how you're going to respond to an action like this, and you know how to do that. You can go on our website. You can call them up with the phone numbers and emails that we've provided for you in the past. So I would ask that you send us your information on how you feel about this and the news that you've heard that we've shared with you and that's been out in other sources this week. And we'll follow up with you in the coming weeks on how those negotiations are going. Right now, everything is in conference, which means that they are deciding these between a delegation of the House and a delegation of the Senate. The House members that are involved are Representatives Lambeth, Dollar, McGrady, Dobson, Avila, Lewis, Haynes, Malone, Jones, and Brisson. So a smattering of folks from urban and rural communities from all across the state. Senate conferees on this are Heiss, Pate, and Tucker, who have been the main leaders in the Senate on this from HHS all along with Rucho, Craywick, Behringer, McKissick, Brown, and Apodaca. So you'll recognize a lot of those names as the very same people that are also negotiating the budget. So I think where goes the budget goes Medicaid right now, and vice versa. So as we wrap up this session in the next couple of weeks, I think you'll see those two things going side by side, or simultaneous at least. So we need you to stay engaged with those members and other members as well as us so that we can know how to best advocate for you. Thanks again for joining us, and we look forward to keeping you updated in weeks to come.